Welcome to the What Matters Today podcast from the Geneva Graduate Institute. I'm Dan Graham, Head of Communications at the Institute. In this podcast series, we ask members of our faculty to comment on key global issues. In this episode, we delve into the significant and controversial decision of the United States to withdraw from the World Health Organization. We'll discuss the legal ramifications of this move and whether it marks the end of the long-standing relationship between the WHO and the United States. The conversation will cover the potential consequences for global public health, especially in terms of funding and pandemic response coordination. Additionally, we'll examine how this withdrawal might specifically impact public health initiatives in Africa, which heavily rely on U.S. support. Finally, we'll look at how this withdrawal could affect international Geneva and its crucial role in global health governance. Joining me for this episode is Gian Luca Burci. Gian Luca is adjunct professor of international law here at the Geneva Graduate Institute. He is also the director of the joint LLM on global health law and governance between the Institute and Georgetown Law School, as well as academic advisor in the Global Health Center here at the Institute. He also served in the legal office of the World Health Organization since 1998 and was its legal counsel from 2005 to 2016. Well, first off, Gian Luca, thank you very much for being part of this episode. And one quick thing that you might not remember, you were the first guest. You were the first guest.
Yes,
yes, exactly.
Yes.
So thank you for coming back.
So you invite me for the wrong reasons all the time.
But it's good to have you back on the show. So I'm going to jump right into it. This is a very interesting topic. So what were the main reasons Donald Trump cited for the U.S.'s withdrawal from the WHO?
That's a good question. If you look at the executive order, it refers to what happens in the early phases of COVID. So it goes back to 5 years ago, to something which frankly is history. And the second is to the amount of financial contributions of the US to WHO. But in good part, this is a voluntary contribution. So it's not a demand by WHO. It is evidently the political interest of the US in financing a number of activities that are also in the interest of the US. That's why there's probably more than meets the eye. Difficult to say on the face of the executive order what the reasons are. And that's something we need to keep in mind because he has already hinted that they may reconsider the withdrawal. So go back to Panama, Greenland, and Canada. There seems to be the transactional approach. I want to get something out of this. I don't mean exactly what I'm threatening. So it's so unpredictable. We have to wait and see.
Right. And what are the legal ramifications of the U.S. withdrawing from the WHO?
Fairly complex. First of all, the US, I don't go into the niceties of WHO constitutional law, but the US can withdraw because they were admitted in 1948 on condition that they reserve the right to withdraw. Okay. And the organization accepted that. So they can. But what happened, for example, to international health regulations that are very important for the prevention of pandemics and so on, that's a bit of a legal gray area. Does it mean that we also withdraw from the regulation, that we remain parties to the regulation? That's a bit of a legal gray area, but of great political and practical importance. The other consequence is financial, because the US right now has frozen immediately for at least 2-3 months all financial contributions. And that has left WHO, and not only WHO, in a very difficult situation, because the US is a major funder and many activities more or less are frozen, because there's all of a sudden, from one day to the next, there's no funding to support them.
Right.
So I would say legal, financial, and obviously political.
Thank you for that. And does this withdrawal signify the end of the relationship between the WHO and the United States?
That's another good question. As I can say, there's a lot still uncertain because, as you know, President Trump more or less has ordered a freezing, even at the domestic level, on many health agencies while they review and reconsider what is in American interest. So one possibility is an absolute cut, so no more relationship. I find it difficult to believe. Another possibility is a selective engagement, for example, allowing federal officials to be expert on WHO's expert committees, or maybe financing a la carte a few things that are in the American interest. So there are several possibilities. One important point is that it's not only the government. WHO has many deep connection with the universities, with the research centers that are not part of the government.
Right.
So will they continue, or will these universities not want to pick a fight with the federal government? So they will also be very cautious. That to me would be a very important test of, also if you want, the resilience of American democracy. Not everything can be dictated by Trump.
Right. What potential consequences could this withdrawal have on global health, especially regarding funding and pandemic response coordination?
Well, the funding, again, we wait to see. For the moment, has been a bit of a shock and awe approach in freezing funding immediately. On health security, so the prevention of pandemic and so on, I find it very hard to believe that the US can disengage and retreat away from multilateralism, because it's impossible to control, to prevent pandemics, other outbreaks on a unilateral basis. You need to do it in a partnership multilaterally. Right. So I don't think that the US will really close the door and refuse to cooperate. That's why I think they're taking time. There's clearly a deep reconsideration of what is in the American interest, but the US will remain engaged. The US has been a leader in this from the 1990s, from the response to HIV/AIDS all the way to today. And I think some form of leadership, whatever President Trump can say, will remain. But I think it will take a while before we have a clearer picture.
Okay. And how might this withdrawal specifically impact public health initiatives in Africa, for example?
Africa is very vulnerable because, for example, HIV/AIDS is very heavily dependent from the United States. Mm-hmm. The US is by far the largest funders of the HIV/AIDS program in sub-Saharan Africa, through WHO, through UNAIDS, through UNICEF, through NGOs, and so on. So if there is a total freeze, the African region will be probably the hardest hit. I would like to recall that the biggest initiative, what you call PEPFAR, which is a special initiative on HIV/AIDS that was set up by President Bush, so by Republican administration. And until now, we're talking about $15-20 billion that have gone into AIDS prevention and response, specifically in Africa. And that also, the program can be at risk right now. So that's quite dramatic for the African region, I think. In particular on HIV/AIDS and to a certain extent tuberculosis, some of the big diseases that affect disproportionately, I think, the African region.
Yeah. And what are the potential repercussions of this withdrawal for the US itself? Because some have even described this as an own goal.
Yeah, that's the other aspect that is a bit hard to understand, because the US, in a way, gets quite a bit of influence through WHO for relatively little amount of money. President Trump sounds very transactional. Mm-hmm. So what, value for money, and, we pay too much. But he pays relatively little for quite a bit of influence, not just on pandemics and these kind of things, but also on pharmaceutical issues. The pharma industry in the US is very powerful, it's a big lobby. And WHO is quite an important role in setting standards for pharmaceutical. And US experts are very involved, deeply involved. Hard for me to imagine that he will totally disengage and be out of the door while WHO continues to prepare the standards without any American influence. That's why I wonder whether this shock and awe approach is a first step to a return to WHO, but trying to extract certain conditions. Mm-hmm. I wouldn't exclude it. Yeah.
And could the U.S. withdrawal from the WHO significantly affect international Geneva and its role in global health governance?
Yes, also because, again, the US withdrawal and freezing go way beyond WHO. UNICEF, many agencies are affected. And unfortunately, right now, the other two big organizations, which are the Global Fund Against HIV, Tuberculosis and Malaria, and Gavi, the Vaccine Alliance, they are both busy in the replenishment exercise. So this year, they will both ask for billions and billions of dollars. And if the US is really retreating from this, that will have a major repercussion on the whole Geneva ecosystem in health and beyond. So it's bigger than WHO.
We have time for one more question to ask about how is China going to benefit from this situation, and if they will.
China, if the US leaves a void, somebody will fill that void. And who can fill that void? The Europeans, but you can see it's not a good moment. More and more right-wing governments that are not particularly interested in multilateralism. It's a stingy donor. It's all the complications of the European Union dimension. So China seems like an obvious candidate. However, the Chinese, at least in my impression, have always been a bit sitting on the fence on many things. Have been working more bilaterally than multilaterally. Also in the pandemic agreement negotiation, the Chinese have been always a bit sort of waiting to see what happens, been more reactive than proactive. So obviously everybody says that the US retreats, China will fill the void. But let's wait and see if they are interested in filling the void, how they will fill that void. It could be through WHO, but it could be, again, increasing the bilateral diplomacy, which is the one they prefer by far, because it's not all the compromise of a multilateral approach. They can really bring, in a way, the leverage, the power on a one-to-one basis. So, yeah, there too, I think we wait and see.
All right, great. Thank you very much, Gian Luca, for joining us in this episode.
Thank you for inviting me. Next time, maybe not for something negative. A new accomplishment in global health.
We'll try to definitely find a good topic on that. This podcast series is produced by the Geneva Graduate Institute Communications team. For more information about the Institute, please visit our website at graduateinstitute.ch. I'm Dan Graham. Thanks for listening.